Dr. Erin Kennedy is the Assistant Dean of Curriculum and Integrated Learning at the KCU College of Dental Medicine.
And she is here today to share tips for handling dental emergencies. We talked about this earlier, Doctor, and it seems like everybody has the dentist appointments, you know, for the cleaning and everything, but it seems like emergency-wise, there are a lot of dental emergencies.
Absolutely. You know, not everything is a dental emergency, like you mentioned. We have a lot of routine appointments, but there are also things that can come up that are a true dental emergency. You know, if you have swelling, if you have tooth pain, if you have bleeding that is lasting for longer than your clinician anticipated, if you fall down and either hit your teeth or your jaw, those are all examples of dental emergencies we want to treat really swiftly.
Okay, so how do we treat them swiftly? What's the first step?
Let's start with tooth pain. Okay, if you have tooth pain, your first step is to make sure that you reach out to a dentist. It's the holiday season, and so sometimes we see an uptick in tooth pain because people get really stressed, and it's that time of year, and so sometimes we see more dental emergencies.
So how does stress equal
Stress impacts your immune system, and so sometimes you won't start to have tooth pain until you start to get really stressed. Sometimes you're clenching your teeth more during this time,
that's what I was thinking.
And so that can aggravate it. If you have tooth pain, you can take over-the-counter pain medication like acetaminophen, which is Tylenol, or ibuprofen, which is Motrin or Advil. But your next step is to call and make that appointment. You want to get in as early as possible so that we can treat that tooth pain before it becomes something that's more severe, like a swelling.
Yes, you definitely want to treat that as soon as possible. Okay,
Absolutely.
what are some other examples?
So the next one is the swelling. So if you have tooth pain and it progresses and it's not treated, it can move into a swelling. That can happen, you know, either up here on your jaw, maybe more towards the anterior part of your mouth, but also down here in your lower part of your jaw. If you ever develop a swelling, I want you to seek health care immediately. Call your dentist. If you can't get a hold of a dentist and you have a swelling, you definitely want to go to an urgent care or an emergency department. Anytime you have an infection in what we call your head and neck area, it can become a medical emergency really quickly.
And the swelling is telling you this is an emergency.
Exactly.
Right?
So you can still take those over-the-counter pain relievers. There's another trick that I give my patients that can sometimes give you relief while you're waiting on an appointment, but you can take lukewarm water and a little bit of salt, like a half a teaspoon of salt, and you can rinse with that, and that can provide some relief.
Why does that work? I've done that since I was a little boy, and it seems to really work well.
Yes, salt water
why
really,
does that work?
It helps irrigate the area, it helps clean the area because sometimes there's food or something dislodged up there, but also the salt water really helps because that area is super irritated and often has a sore on it, and the salt water can help with that too. Yeah.
Very good.
But your best bet is to call your dentist and make an appointment because we want to make sure that we take care of your swelling as soon as possible.
At what point do you realize that the pain is at the level that you need to call the dentist? Because everybody gets, you know, maybe a sore tooth or your jaw or your gums, but there comes a point where you need professional help.
So I like to rate pain on a scale of 0 to 10, and I tell patients if you get a 5 and above, you probably want to have that evaluated. The other piece is if it starts to wake you up at night, if it is throbbing, if you have a swelling, if you develop a fever, if you are not sleeping at night at all, I want to make sure that you reach out and you seek care and you get dental care as quickly as possible.
And you can get that great dental care at KCU.
Absolutely,
correct?
And I hope our number flashes on the screen,
sure
but we're
will.
taking patients, and we're really happy to help anyone in the community that has any dental emergencies. I would say it's also almost hockey season. I just have to do my plug for winter sports, but it's really important to not only wear mouth guards, but if you do happen to lose a tooth, you want to get that reimplanted as quickly as possible, typically within an hour. So if you have a kiddo that has an accident and bumps themselves when they're outside sledding or playing hockey or just running in the snow, if you want to call a dentist right away, you want to get them seen within an hour. And while you're transporting that tooth to the dentist, you want to make sure that you care for it. So don't touch the part that's been inside the jaw, the root part of the tooth. You only want to touch the part that you would see if you smile. And then when you transport it, you either want to transport it in milk or you can transport it in a little bit of your saliva, because how healthy and how covered that tooth stays, it helps us implant it better when you get to the dentist.
Wow, that's
Isn't that
great
fun?
advice. That's awesome. Thank you so much.
Yeah, absolutely.
So glad we had you on here today.
Thanks for inviting
being
me,
here.
and happy holidays.
Happy holidays.